Hi, I'm Star O'Hara, and welcome to a new episode of Extremists Being Awesome, the interviews where I talk to extremists about how awesome they are. And today I have on my friend Bretigne Shaffer, who is an Extremists Being Awesome member. She is an author, a podcaster, and a health freedom advocate in Kentucky, newly in Kentucky. And she's a California refugee. And I'm really excited to talk to Bretigne today because she is really um, going hard on this how to secede from the state space, right? And she's got some great ideas and actually has a little group called Building Parallel Solutions that is working on just that. And so we're very excited to have her today. Hi, Bretigne.
Hi, thanks for having me. Um, yeah, how do you want to start? What should I
Well, why don't
talk
you
about?
give us a little bit of background about yourself? How did you come to the freedom advocacy movement and what your main focuses are?
Okay, so I came to it really by birth. I was born into a family of libertarian slash anarchists, and spent my high school and college days arguing with everyone around me from all perspectives, right, left, all of that. And then I went off and I was a journalist for many years. Um, I guess my focus for a long time was kind of on the problems and sort of explaining, well, this is why things are so messed up. This is why such and such isn't working. This is what we need to do. And now that whole system is kind of falling apart, I feel like the most important thing to focus on is building solutions. And what I mean by solutions are things like in education, in healthcare, in kind of the most critical areas where a lot of people do depend on, if not the government directly, systems that are very closely tied into the government. And I mean, I've known for years, even long before COVID, and I think a lot of us have, that these were not sustainable systems. And at some point, they're going to come down, and it's going to be really ugly for the people who, the people who we argue with and, have all kinds of unpleasant things to say about. But nevertheless, they and their families are going to be hurt by this when it comes crashing down, because they can't see it. They don't understand why it's not sustainable. All they know is that they're dependent on it. And so what we can be doing now, and what people are doing, is building the foundations for what those people can land on and what can come next. And that it's really this, we have this tremendous opportunity as the crappiness is falling apart. We have this tremendous opportunity to really, it's almost like a clean slate. We can create the world and the institutions that we want, and that we believe will be much more able to function and to be sustained.
Yeah, I love that. I feel like even within our libertarian slash anarchist community, there's a lot of in deed, if not in word, just waiting for freedom to be handed, to be delivered to us, gift wrapped.
Right.
And of course that's not everybody. I do see a lot of projects taking place, a lot of ideas being built up for how we can kind of veer off from
Mm-hmm.
from the system, from the system. But there is still, it's like, okay, we gotta elect the right people at the state level, and we gotta change the laws, or
Right.
or
Right.
move to X location and everybody's an anarchist there. And it's like, that's okay. Okay, but let's think a little bit deeper about this. the theme for Extremists Being Awesome this month is Where's My Freedom? So, where is it, Brittany?
Um, well, it would be trite to say it's right here. But it kind of is. It's where you make it. And I think you're absolutely right. As libertarians, it's very easy for us to point at what's wrong. And a lot of us have gotten very good at that. And so, you develop that skill and you develop that way of looking at the world. It can be hard to shift gears, but we need to shift gears. You know, we're done being right. That time's past. Yeah, we're right. Now what?
Yeah.
Um, and where's my freedom? It's where we envision it, and it's where we create the foundations where it can exist. So it's in our hands, in the sense that we actually have been handed this tremendous opportunity. And if we don't take advantage of it, if we don't use this to build what we want, then we've really failed.
Yeah.
Um, it's really, and I think for those of us who see that, I think our job is to make it more visible for the ones who don't see it yet, or who maybe don't see the opportunities. Maybe not everybody sees, or maybe it's easy to see that, yeah, the empire's collapsing, it's failing, it's going to be terrible, it's all coming apart. But maybe it's not so easy to see what the opportunities are there, to see so then what things can I do? What can I actually get my hands on and put into action in this new space? And I think sorry about my dog. He's not happy. I think that's the job of those of us who do see those opportunities. you know, don't keep them to yourself. There's such a need for this everywhere, that we really need to be telling the rest of our tribe, of our group, hey, here's something you can do. Here's something you can do. Here's, in education, in healthcare, in finance, in community building, in food freedom, food independence. Here's what some other people are doing. Here's, oh, look over there, look what they're building here. You can do that too. And it's kind of like, we're kind of at the beginning stages. I guess it's like, when personal computers were first a thing, it would have been foolish to think that the first people who jumped on that bandwagon and started, producing software or making games or something, that was all there was to it. There's such a huge wide open vista, that really, the more people who know about this and the more people who can start building things, the better. So that's I think that's what's needed.
That's great. That's a great answer. So when you say this tremendous opportunity has been handed to us, I want to make clear I think that what you mean is that everything's falling apart, kind of.
Yeah, yeah,
um,
yeah, yeah,
the institutions that our society has built up and relied upon to the point of becoming apathetic about,
yeah, yeah, and dependent.
right, apathetic and dependent, those things are starting to really fall apart. It may not be obvious to the average person yet, but I think it's starting to become obvious when you go to the grocery store.
Mm-hmm.
When the main thing, the main aspect falling apart that's kind of in everybody's face right now is the currency. This is something that we've
Yeah, yeah,
relied upon and we've had total trust in, most of us, most people around the world, not just in the United States, was the US dollar. And now it's in our faces every day. The US dollar is crumbling, right?
right, right.
So
Which
that's
some of us have been predicting for decades.
exactly.
But predicting it isn't the same as having a workable alternative to jump into.
Mhm.
Although, some of the, that sort of exists now. There are alternatives. But it's still, as far as usability, I think it's still in its infancy. It may not seem that way, but I think it really is.
Right. So and so I think, am I right about what you mean when you say
Yeah,
this
yeah,
opportunity has been handed to us?
yeah, yeah.
That's just one example. Of course, we can, people who are kind of hip to health freedom issues can see another big glaring example there with how the medical system kind of has just bowed down to it unverified narrative about a certain
Witchcraft. You can
thing.
say it.
Okay, yeah. Which, so anyway, that's happening, and then there are plenty of other examples, but give me the vision. Like, what specifically can we do in some of these areas to kind of start to take responsibility back from the institutions that we have become too reliant upon?
Yeah, so a great example is in education, and there's already been this tremendous boom. Um, I mean, it's surprised even people who've been watching like the homeschooling space for a long time were kind of shocked at how much of an exodus there's been from government schools. And what's been happening is people are starting up all over the place, and it looks different everywhere. People are starting up learning pods or little independent schools, micro schools, all kinds of creative ways, little villages where homeschooling families come together and do activities together. And it's not all homeschooling. Some of it is like it's a school structure, but it's done independently. And so there's all this, and Carrie McDonald is a great person to follow for this because she covers a lot of the homeschooling, or I should say educational entrepreneurship is really what it is, because it's people realizing the extent to which the system has failed them and saying, oh, this is crap, I'm going to do it on my own. And they're doing it. So I think that's a really vibrant example. It's something that's just flowering all over the country. But also like in healthcare. So one of the consequences of the lockdowns and all the craziness is that many hospitals have shut down. They were told not to take anyone except COVID patients and not to treat, don't allow people to come in for their cancer diagnoses or treatment or anything. And so they kind of in a to a large extent stopped functioning for many months, if not, a year and a half or so. And apparently whatever government money they were getting to do that wasn't enough, because a lot of hospitals have closed. And even now, I follow the hospital news and I'll see, such and such hospital is shutting down its maternity department or shutting down its ER department, or, they're trimming back, they're scaling back. And so I had to go in to urgent care once, or it's like couldn't get into urgent care, so went to an ER, and they said, yeah, it's crazy. There's just people, there are long lines. There just aren't enough staff. There's not enough staff. So yeah, that's kind of what happens when you kick out a bunch of people for not wanting to take your poison jab.
Right.
But there were a lot of factors. There was also the fact that, they were deprived of their business for many, many months. So that's something that I'm not sure people are feeling that yet, the way that they're feeling prices increasing, but that's a real thing. Our supply of medical care, our supply of hospital facilities and staff has gone down substantially in the last couple of years. So, the answer to that is build your own, start your own. And the first objection to that is going to be, well, there are certificate of need laws and there's all kinds of regulation and you'll never get past the regulatory hurdles. That's why I'm so excited about private membership associations, because if you're doing it in the private sphere, there's quite a lot you can do. Actually, there's some things you can't do, but there's quite a lot that you can do to replace those services, and to do it in a way that you're not under the thumb of the government agencies saying, well, all your staff has to be vaccinated, or, we're going to hand out, we're going to give you all this great money if you do everything the way we tell you to. So it's really a way of, in many ways, breaking free of what has been this stranglehold. I mean, the regulatory state has had a stranglehold on medicine for decades. And now it's gotten to the point of just absurdity. When you hear some of the stories coming out of hospitals and things, it's insane. It's gotten to that point where maybe there's enough momentum now that there's a market for, standalone clinics, ERs, maternity hospitals. That I call them hospitals, but of course, if it's a PMA, you wouldn't call it a hospital, you just call it something else. So that's huge, and people are starting to do that. There's I could give some examples. Gold Care, started by Dr. Simone Gold. They're starting up Gold Care clinics. They also have like a nationwide, it's like if you become a member, you get access to online medicine, but also kind of referrals as to people in your area who might, not be taken in by the craziness, and who could treat you. So that kind of thing is starting up. But again, it's like it's in its infancy, and we need a lot more of it.
Yeah. So kind of walk me through like what a private membership association or how it works. In specifically, how would it work in the medical space?
Okay, so it's basically, the idea is you are you're not serving the public. As a PMA, you are serving members. And they've signed on as members. You have a record of that. They've agreed, to your terms, and, whatever the terms of your membership organization are, they've agreed to that. They're members. It's like conducting business. I call it business, but it's not public business. It's conducting business in the private sphere, basically. And so the regulatory state, I don't want to say it doesn't apply entirely, because, and this applies in medicine, one of the issues that comes up is, the FDA, you still can't have access to medications that are regulated by the FDA unless you have a medical license, whether you're acting in the private or the public sphere. So there are some limitations. Sorry, I'm just waving at my husband who's walking out the door. But essentially, when you're operating as a PMA, you are operating in the private sphere, which means that you don't have to comply with like health and safety codes, statutory requirements, anti-discrimination laws, things like it. You are not subject to those kinds of laws. You are, of course, still subject to, criminal law. You can't kill your customers. You can't steal from them, that kind of thing. But as far as statutory law, as far as the law that governs businesses operating in the public sphere, for the most part, do not apply to quote unquote businesses operating in the private sphere. So that's sort of essentially what it is. If you're doing this in the medical sphere, and a lot of doctors actually have set up their businesses as PMAs, and sometimes, you can operate part of your business as a PMA, and then have, you could have both. You could have a PMA business and a DPC, a direct to patient business. You could do both of those. However, you are still, and you can operate as a PMA without a medical license. However, if you want to be prescribing medications, you need a license for that. There's actually a book, a doctor actually wrote a book a while ago about how to operate in the private sphere, what you can do as a doctor without a license. And I can send you the link to that if you're interested,
Sure, throw it up on the video notes. That would be great.
Okay. Yeah. I'm gonna have to hunt it down, but
also Carrie McDonald, who you mentioned earlier, we'll have to put her stuff.
Okay. Make a note of that.
So that's really interesting that you might not actually have to have a medical license in order to start a PMA clinic that would serve the medical needs of people in your local community.
Yes, you need to, so one thing about PMAs is you need to be very careful about how you set it up. The language in your founding documents has to be completely non-statutory. It has to establish you in the private realm. Some people have screwed up by putting language in there that, without intending to, puts them in the public realm, and into the statutory realm. So you need to really have people who know what they're doing help you with the paperwork and do the paperwork. And then everything you do, you have to be super, super careful about not doing things, or, not in some way putting yourself into the public realm. So it's not, I make it sound really easy. It's a simple concept, but you need to be careful in setting it up, and you need to get good advice and understand what you're doing, what you can and can't do. If you accidentally offer services to someone who's not a member, you've opened yourself up now. You're now,
Right.
so I don't want to make it sound like it's simpler than it is.
Okay. So um the way the way I see this happening, it would be probably it's like the revolution will be local, you know.
Mm-hmm.
Um I could see something like this becoming a chain nationwide, but of course you're going to have different, in addition to the US regulatory code, you're going to also have different state codes and local um, laws to contend with. But if it if it was done, locally in the places that were most amenable to it, like I think that's why in the food in the food sovereignty sphere, Maine has had a recent great big success, and it's probably because Maine was already like the Maine state laws were already set up to be more friendly to something like that.
Yeah, and it also depends on sort of the temperament of the people in your area. Just because you're on the right side of the law, and even if your paperwork is completely perfect and you're doing everything perfectly right, that doesn't mean that local law enforcers or the local health department are going to know what that means. And yes, you will probably end up winning if it goes to court, but you don't want to go to court.
No.
So some people, um Mike Colomb is a big proponent of the PMA movement, and is really helping people to get started with that. He and his wife have a PMA up in Northern California, and they have had to, he calls it educating the local authorities, because they'll have like health inspectors come to their PMA grocery store and say, and then they have a sign out front saying, and he recommends doing this, saying, if you are with the government and you're here um, on official business, or if you're here as a representative of the government, you're trespassing, you need to leave. And they've had to tell that to a number of people who come and want to, inspect, or want to hand them information about the laws they're supposed to be complying to, and they're just very clear: no, we're not taking, that's litter, you can't leave that here, you're trespassing, you've got to go. And usually in their experience, and I've heard this from other people too, generally, especially if you're talking to sort of higher up people, they do get it when you explain to them you don't have jurisdiction here. um you know a, a a random police officer might not get that, but his boss is going to.
Right.
And in the health department, it sounds like the experiences they've had have been, once we explain it to them, they either say, okay, well, I've got to go and talk to my superiors and I'll come back, or they do get it and they don't come back. So it can be a hassle. You
Yeah.
can definitely get hassled, and it's absolutely, a better idea to set up shop someplace where the local authorities are already friendly to
Right.
that kind of thing, or maybe just smaller, where it's not California or,
Yeah.
some menacing police state.
Mhm.
Um, just for ease of use, just for so that you're not tied up in conflict all the time.
Sure. Okay. One thing that you said when you were talking about what was the guy's name?
Mike Cologne.
Mike Cologne. Okay. I've never heard of him, but I got really excited when you said PMA grocery store.
Mm.
Okay, so we've talked about education, we've talked about healthcare. Um, what are the benefits of a PMA grocery store? Tell me.
That's a great question because other than just so let me start with the benefits to the people running it, because as a customer, you might not notice the benefits. So the benefits for running and I should also add, it's not just a PMA. They've also set up as a church. So it's a nonprofit. And so that has tax advantages for them. Um, I think for a grocery store, this is actually a great question. I'm going to have to think this through. So there's sort of the general benefits of operating as a nonprofit and not having to have the regulatory state come in. I mean, a lot of it just has to do with if you're running any business, and a restaurant it's probably more onerous on a restaurant than on a grocery store, but having to comply with health and safety codes gets expensive. They can shut you down. um that's probably less so with the grocery store, but the issue still exists. They can come in and say, you know you've got to have a fire door here, or you've got to have wheelchair access, or you have to have 6 employees here instead of 2. Or they can fine you. They can fine you for not complying with this stuff. They can also, and this is just business wide, what we saw during the last 2 years is businesses were told they had to um, require that they had to either shut down. In California, they had to shut down for certain periods. They had to not have people inside, or they had to limit the number of people who could come inside at a time. They had to demand that people wear masks. So all this stuff, I think what we saw during I'm not going to call it a pandemic, during that time.
What that
Um,
was.
yeah, what that
The
was.
Troubles.
The Troubles, what we saw during the Troubles is that the local state authorities really have total power over businesses.
Right.
And if they, and it's through licensing, it's because they're licensed by the state. And when I say the state, I mean, it's usually the city. It's a city or the county. And so what we saw was, no matter how absurd their demands are, make your customers all wear masks, make them dance a silly dance on entering the store, whatever it is, they can't breathe while they're in the store, whatever the demand is, they can enforce that because you are licensed by them. And so I think what we've seen in these last couple of years is that the power to license is total power. It's
Right.
complete and total power. And so from the business owner's perspective, having a PMA grocery store means they can't come in and tell you that your customers have to wear masks. They can't tell you you have to shut down. They can't tell you you can only have 10 people in the store at a time. They can't dictate any of that. And so, the customer is not going to notice that all the time, but certainly if there's another episode like the Troubles, they'll notice that you're the only store that's open, and they'll come and they'll do business with you. And then just apart from that, it costs less to operate a business when you don't have all these arbitrary demands being made on you. And I can give a real life example from my own family. My grandmother what she was a school teacher. She was born in 1900. She was a school teacher, and she was a member of, it really was a PMA. It was a mutual aid society called the PEO Society. And it was for women school teachers, and it supported women's education. They have a college. They built this college. They take donations. And one of the things that they used to also provide was they had these retirement homes around the country where if you were a member in good standing, and if you could kind of take care of yourself when you decided you wanted to come and live in one of these homes, as long as you were somewhat mobile and you could get around, I don't know exactly what their criteria were, you could come and stay there. You could live out your days there. And the deal was, you had to sell your assets and then give a percentage of your assets to the PEO, and that's how they funded it. But my grandmother lived in a podunk little town in Nebraska. She sold her house. It was for like around, I'm going to say $20,000 at the most. This was several years ago. That chunk of change would not be enough in any commercial retirement home. That would last a few months. She lived out the rest of her days. She spent 8 years in this home, totally, completely taken care of. Actually, an amazing level of care. I mean, it was a home in this. It did not have an institutional feel at all. It was an old Victorian house that had been renovated. They lived together. They did activities together. It was really wonderful, and the staff to resident ratio was very high. It was a wonderful place to live. And I spoke with the manager when I visited her. Again, this was many years ago, but I spoke with the manager, and she said, yeah, we're able to provide this level of care because we're a membership organization. We are not subject to the licensing restrictions. If you set up a licensed care facility, there are all these restrictions that come with it, and and they can come in and do snap inspections. They can shut you down. They can fine you. They can come in and say, oh, I saw a cockroach in the kitchen, or I saw, there was a stain in the bathroom. We're going to fine you $10,000.
Yeah.
And that stuff can add up. And just trying to comply with that stuff can add up. And what's ironic to me, and what I hope people can understand, is that not being subject to those regulations doesn't make you a lesser quality place. The home that my grandmother lived in was completely clean, I mean, it was such a higher level of care than you would find and I've seen other facilities. I've visited other elder care places. I've never seen anything this good. And if there had ever been a problem with, a safety concern or anything like that, we would talk directly with the manager and they would address it. It's not, nothing like that ever came up. Whereas with a big institution, you're dealing with an institution that protects itself. And in my experience, what I've seen, with other family members and people I know, is you don't get a lot of response. Right. When there's an issue. It's a whole bureaucracy, it's a whole system, and it's really hard to address problems in like an institutional sort of elder care place. So the level of care was incredible. We were so pleased with it. And I think people have this, maybe not libertarians, but I think a lot of people have this mixed up idea that you need this regulatory state in order to guarantee good quality. For whatever reason, it kind of ends up being the opposite. Yeah. When people are free to design something their own way and handle things their own way and deal with problems as they come up, the result ends up being so much better. And in my personal experience, they were much more accountable than, commercial, big institutional homes.
So it was higher quality care. The people who were in it were more accountable. It was more affordable to the patient and their family, or not patient, the resident and their family. And then what happened? What happened to this organization? Because I read your article.
Yeah. So what happened was, this was in Nebraska, and the state of Nebraska came in and said they didn't. So I don't know the specifics of why they all shut down elsewhere in the country. It's actually a story I want to dig into, and I'm having trouble finding the right people to talk to. But my guess is that it was something similar to what happened in Nebraska. So the home that my grandmother lived in is still there. But what happened soon after she passed away, the state of Nebraska said they changed the law so that that kind of funding, what was it? This is from my recollection, so I might be getting some of the details wrong here. My understanding, my recollection of this is there were two things. They objected to the way they were funding it, which was, you, whatever income level you're at, you donate a portion of your assets and it goes into this pool and that's how it's funded. What I was told by the new manager who took over was the state of Nebraska said, that's not fair. And so you can't do that anymore. And the reason they were able to do that is, again, like a few years after my grandmother passed away, they changed the law so that membership associations were no longer exempt from the kind of oversight from these departments. I don't believe you can change that law. My suspicion is that their organization was set up to be statutory compliant, and again, I haven't seen their paperwork. I'm saying what my educated guess is about what happened.
Yeah.
My guess is that their paperwork did not place them entirely in the private realm, and that they were beholden to, they were under the jurisdiction in some way of statutory law. Because what it sounds like to me is that they changed statutory law so that they now had to comply even as a membership organization. And that brought them in to require, they now had to live up to these standards and stuff. This is based on conversations I had with the managers, after the fact. And again, I'm trying to find people who can give me more clarity and more detailed information on what happened. But essentially, the state of Nebraska said, no, you can't do it this way anymore. They're still in operation, but it's not as affordable. So the residents now have to pay monthly rent to be there. There are other things that the home had to do to be compliant with licensing codes and things, but I don't have all the details on that.
I'm guessing that the staff and management left.
Well, the manager who I had spoken with years ago did leave. She said, I can't provide the level of care that we have been providing within this new regime. It's not possible. So I can't do it. So she retired, she left. A new manager came in and I spoke with her too. And, she was also not happy about it. And she said the residents were really not happy about it. They saw the changes and they were pissed. So yeah.
Well, that is a sad story, but it's predictable. I mean, it's like whenever you have something that's free and good, and the government has to come along and at least try to stop it from being free and good. So that's probably, as private membership associations, become more popular, that's probably something that we're going to have to contend with.
Yes.
I mean, at the moment, you can say, well, just you got to get some really good legal advice to help you structure it in such a way that you're not having to interface with the statutory aspect of everything. But then the state comes along and says, well, there's too many of these private membership associations springing up. We're going to have to change the law so that private membership associations are under, Ohio jurisdiction or whatever.
I mean, yes. So I think it it may be a battle. I think in many cases it will be a battle. The good news is that the Supreme Court has ruled on the right to free association, and in business dealings. So our right to do this, I believe, is firmly entrenched in the law. So so we've got that on our side. But as we all know, just because you have the law on your side doesn't mean they're not going to come in and harass you,
Right.
or claim, take you to court, charge you with something. So yeah, I also feel that the people who set up my grandmother's PMA, they may not, they weren't doing it. This was like in the 1920s probably that they started it.
They
So
weren't like, we're anarchists and we're gonna have
right,
an anarchist nursing home. That wasn't
right.
their deal.
I mean, I think they did understand the benefits of operating as a membership association,
Mhm.
but they weren't up against it the way we are now. And I'm guessing that they, were not as aware of their rights as someone starting a PMA today for these reasons,
Right.
might actually take the state of Nebraska to court and say, no, you don't have the right to do that.
Mhm.
We're going to keep on operating as we have been. You're in the wrong here. If you don't do that, yeah, you're going to get crushed.
Yeah.
And I also recognize, not everybody wants to spend their time fighting those battles, but some of us are going to have to.
Yeah.
That's just the territory we're in right now. But the more people who are doing this, the harder it's going to be for them to fight it.
Exactly. If you're dealing with let's say the state of, I don't know,
Let's
uh
say Georgia.
let's say Georgia. That's what I was thinking. Good. So let's say the state of Georgia has 3 private membership associations that are starting to get a little bit annoying to the government.
Mhm.
Um,
Or to their competitors, to the insurance
yeah, to
industry
their
or
competitor.
somebody.
Right.
Yeah.
There's a an educational one and a medical one, and let's say maybe one about food or something. And the state of Georgia says, you know what, we've had all these complaints about these private membership associations. And the reason why they're getting the complaints from the competitors and from people who are just like statist busybodies is because
Mhm.
they're doing so well
Yep.
and providing such great services for people.
Yeah.
And so they're
Yeah.
growing in popularity. And Georgia's like, we got to put a stop to this. Let's do some legislation about private membership associations. And so um, while that's going through, if 30 more private membership associations spring up, I don't
Yeah.
know. It's like
Yeah.
it becomes whack-a-mole, right? And
Yeah.
eventually, if there's enough private membership associations providing great services that people can see obviously clearly are better than the alternative,
Yeah.
that entrenched and bureaucratic and kind of violent or whatever,
Yeah.
then they're just going to start voluntarily choosing these. Eventually, if that is successful and we do have people running the associations that are like willing to fight for it in court if it becomes a problem, um eventually there'll just be. Have you ever read Neil Stephenson's
Snow Crash.
Snow Crash?
Yes. Yes. I love Snow Crash.
I
I
love
love Snow
Snow
Crash.
Crash too. And I know like libertarians that I've talked to about Snow Crash are kind of split down the middle about it. Some of them are like, this paints an awful picture of a libertarian society. And some of them are like, that's just because you don't want to live in the burb clave or whatever. Like,
Uh-huh.
you know,
Well,
okay, fine.
and Stevenson disavowed it after 9/11. I was shocked. He was speaking. I don't remember exactly when this was, but it was it was months after 9/11, and he spoke at a Barnes and Noble down in Manhattan, and I went to listen to him, and somebody asked him a question about his support for this vision of like micronations, or like small um sovereign groups. And I was so disappointed in his answer. He said he said, well, I don't want to put words in his mouth because this is a paraphrase, but no, I don't support that anymore. 9/11 changed all of that. It's like, what? What did you do thing?
So this staged, like, weird multinational conflict yeah, okay.
Right,
Whatever.
right.
But
Or because we got, terrorism and small criminal gangs have been inflicting damage all over the world, forever. Let's not even talk about the big criminal gangs, but because it hits your country one time, that changes
yeah,
everything.
right.
No,
So for the listener, if you haven't read Snow Crash,
read it.
read it. It's really amazing. And I think that the main thing, we're talking about private membership associations, and this is a society that's basically built upon private membership associations and borderless societies. So
Mhm.
if you have common interests with a group of people, you guys enjoy doing things this way. Maybe you're a member of a certain religion or a certain cultural group, or just like, oh, we're into big tech, or we're whatever. There's a borderless nation for you, and they own everything is property based. So, like, nation A, let's call it Star. I have my own nation, Star Nation, and I have a property in Phoenix, and I have a property in London, and I have a property in, like, I don't know, New Delhi or something. And anybody who's a citizen of Star Nation can always go and check into one of those properties and just kind of chill, right? But when you leave your nation's property, then you might, if you want to go into another nation's property, they have to vet you or whatever,
Or
because
you
you're
pay a surcharge or something.
right.
Yeah,
Right. And it's not that it's a problemless society.
because that doesn't exist.
Right. There's no such thing. But the way that it's very interesting, the way that interpersonal and business to business and these types of conflicts are worked out.
Yeah.
Type of arrangement.
Well, the whole border thing is really interesting because you say borderless, and I feel like this point needs to be driven home. If you have a if you have a world that has no state borders, no nation borders, no monopoly state borders, that doesn't make it borderless.
Right.
It's you have as long as there's private property owners then determine the borders. They then determine their borders, and they all have there's some degree of interest in allowing other people to cross your borders, and you want to be able to cross other people's borders. So to me, the idea of private borders is so much more, there's so much more real accountability there. What we see now in so many instances is really the tragedy of the commons because of nation state borders.
Right.
And because of things like, in Europe, bringing in big immigrant populations and then not allowing them to work, but subsidizing them being there and being in conflict with the local culture. That's a tragedy of the commons. That's not a problem of open borders. That's a problem of politicians, doing something destructive within this territory they call their own, but they're really not accountable for. When you have private ownership, the people who are making those decisions actually care about, they don't have a vested interest in trashing their own property. So I think the idea of private borders, I just feel like that's something that needs to be discussed more because.
Yeah, I agree. I feel like, yeah, when I use the word borderless, I'm talking about, like, the politicized borders, state borders. Obviously, when I am dealing with my neighbors, we have property borders or property perimeters that buffer each other, that rub up against each other.
But you probably don't have a big electrified fence.
I do not. My neighbor can freely walk onto my I have a barbed wire fence, but there are places where my neighbors can walk freely onto my property without
And you don't have
just
border agents sitting there, watching to see if they.
no, I don't. I haven't found it necessary yet. I'll just say that. I don't know. I just wanted to throw this in there too. Another Neil Stevenson book is called The Diamond Age, which I
Yeah.
feel like takes place in the same world, but at a different time period. And they still have this same, like, very anarchist way of structuring society with private membership associations and borderless nations, because I don't know what else to call it.
Yeah.
I mean,
Borderless.
the
Yeah.
nations are, it's basically a private membership association that you're a citizen of. They have their own legal structure, they have their own
Right.
moral code or whatever, and then there's private independent courts that decide conflicts between these membership associations. So if I belong,
Yeah.
I would never, but if I belong to the Maoist nation, and you belong to like the Rothbard nation, and we got into a scuffle on the street or something,
Yeah.
then the Maoist nation would provide my legal representation, and the Rothbard nation would provide yours, and we'd go to an independent court to settle
Yeah.
them out.
Yeah. Yeah. And there's so much like academic writing that's been done on those kinds of models, on how to, you know, how private justice can work, how private legal systems, independent of each other, but connected and working together, can work. Um, and these are not new ideas. They're actually, when you look back at the history of courts, there were the merchant courts that started out kind of like that. They weren't imposed from the top down. They were, merchants who needed to get their disputes resolved,
Mhm.
and came up with these, found people to be the judges, and came up with these, you know, entities where they could go and get this done. So it's
Right.
not like it's really a new idea.
It's actually, the basis of, I feel like the basis of the idea of courts is fairness and justice, right? And
Hmm.
what we actually have is a an obvious perversion of that,
Yeah.
because
Yeah.
you have the judge and the judge and the law enforcement and the prosecutor all belong to the same entity.
Yeah.
And
Yeah.
so that's obviously a perversion of fairness and justice. So it's a distortion of what um, courts actually were supposed to be.
Right. Right. And sometimes courts will still make, the right ruling. Sometimes they'll still do things, be on the side of justice and rightness, but it's
There's a
not
lot
really,
of
it's
incentive not to.
yes, yes. Yeah. And their foundation is kind of not to, and, they're required to do things like uphold drug laws, for instance. So, yeah, I think if we want real justice, if we want a society that has a just legal framework, it can't be a monopoly.
Right.
And I think that's another thing that it's kind of maybe counterintuitive, or it's opposite to the way most people have been trained to think. But I think by necessity, it cannot be monopolized.
Right. Okay, well, we've packed a lot of into this
Yes.
hour or whatever, but real quick, why don't you tell us about your Substack and about building parallel solutions?
Yes. Okay. So I have two Substacks. I have a sort of public Substack where I just post my articles and things, but I have a private Substack group called Building Parallel Solutions. And it's free, but I also have attached to that a paid option, which is a membership. It's a paid membership group. Also, it's called Building Parallel Solutions. It's intended for people who are serious about building parallel solutions. So if you are working on a project, or if you would like to be working on a project, if this is something that you want to put action into, if it's something that you want to help move forward, then what we do in this group is I post things, I post information about PMAs, about what other people are doing, about projects and things. But then once a month, we have a call with a guest expert. And so this will be somebody like Mike Colomb, someone from Gold Care. We spoke with Susan Sweeten from the Freedom Travel Alliance. It's amazing. It's people who are doing something out in the world, and we talk with them once a month. We just get on with them and we just pick their brains. We find out what they're doing. We ask our questions, try to come away with insights or information that we can then use in our projects. We also are starting to we just have like regular sort of check-in calls where we just kind of hang out and shoot the breeze and connect with each other and talk about our own projects and things. So it's a group for people who want to be a part of this, people who want to either build something themselves, maybe support other people building it, or who are just fleshing out ideas and who want to like come up with, who want to know what's available in terms of tools, in terms of what other people are doing. Yeah, that's what it is.
So, and the paid membership part or the building parallel solutions has been around for like, I want to say 3 or 4 months. 4 months.
So, good question. I opened up the paid membership part of it was it July 4th. I opened it on July 4th. But it was
Independence Day.
Yeah. So what I did though was I did a founding members launch. So I opened it up for like a week, I think it was, and got a bunch of people in. It's just a small group of people right now. And then I closed membership. So membership is right now closed. I'm going to open that up again. I'm hoping in November. We spent this time kind of tinkering with it, figuring out what features, what do we want to do? How many meetings do we want to have? What do we want to do in our meetings? That kind of thing. So I'm going to be opening up, and I wish I had I don't have a date right now, but if anyone is interested, please just email me. It's my first name, Bretigne@gmail.com. Email me with something about, building parallel solutions in the title, and I can put you on a list, or I can talk to you about it and let you know when it's open again.
Cool. And I will put that also in the show notes, appropriately spaced, so that you don't get any spam.
Yes, thank you.
Bots stalking you. But one more question about building parallel solutions. So I know it's still kind of small, and it's going to grow. But so far, what kinds of things are people working on? Are you doing any activation of projects?
So there's I don't want to give away people's personal information, but there's somebody working on a medical freedom kind of networking thing where it's connecting people with doctors, connecting across the country, like with freedom-minded doctors. Another person I don't think is actively has started working on this yet, but the vision is to create a free, when I say free, I mean free from coercion, maternity birthing center type of place. Let me think. There's my own project, which I'm working on creating a long-term living facility for people with special needs. And that's something I had planned before I started this group. That's my thing. And I'm also talking with other people locally about setting up some medical freedom initiatives, which I don't want to talk about yet because it's not, I'm not saying anything publicly about it yet. I know I'm leaving something out because yeah, somebody's working on, I'll just be very vague here, like networking support, like information support, infotech support for people in maintaining private systems, privacy. And I know I'm leaving something else out, but those are just some of the things that folks are working on.
That's amazing. And I'm probably, well, I missed the first thing, but I'm going to be joining Building Parallel Solutions when it opens back up for subscriptions, and I would like to start researching. I already have started researching and gathering information for this, but a kind of a food sovereignty PMA in my local area, which, going back to the question when I said what's the benefit of a PMA grocery store, I hadn't thought of it in terms of a grocery store because I was still thinking along the lines of like a just a membership with no set location. But
Mm,
one of the benefits could be, if you could really structure it right, skirting laws about meat and dairy, uh,
mhm.
inspection and, regulations that these poor small farmers have to contend with, that often puts them out of business because
Yeah,
they can't compete with the big factory farms. I mean, like, really, if you want, I know so many people are like, we've got to end factory farming, we've got to end these horrible like butchering practices and stuff, and I totally agree. But the problem is the system is set up to where small farmers who want to do ethical and sustainable practices cannot compete with the big
yep,
factory farms.
yep,
They are
yep.
subject to all of these laws and regulations that make it impossible for them to, um, especially if they're doing meat and dairy.
Yeah, so
Impossible.
there's a couple of organizations, I can send you the links to them. I don't know if you've heard of Texas Slim and the, what's it called? Is it the Beef Project or the, I'll send you a link to his. That's exactly what he's up to. He's up to fixing that in meat. And
Yeah.
then what's it called? I'll send you Niti Bali. I don't know if you've heard of her. I'll
Mm-mm.
send you her link too, because she's all about that. And they've got, you should be aware of what they're up to.
Okay.
So,
And I think that wraps it up. We've been going for about an hour, so
okay.
it was a
All right.
great discussion, Brittany.
Yeah,
Thanks
great
for
talking to
joining me.
you. Yeah.
And I will put all your links in the comments.
Awesome.
And I hope you have a great rest of your day.
Yeah, you too. Thanks.